Discharging a patient from the hospital can sometimes be very stressful. I remember the first time I was asked to discharge a patient. I didn't know what to do and how to do it. No one mentioned to me how to write a note or what to even mention in my note. But over the years, I really became more familiar with the process, and the goal of today's video is to make you prepared to discharge your first patient when you start your residency. Welcome everyone to a new episode. My name is Roupen. I'm an internal medicine resident in Canada, and I love internal medicine. I'm passionate about medicine, and my goal through this channel is to explain common skills that you should know for your residency and makes it easier for you. If you like this video, please hit the like button and subscribe to the channel. And if you have any questions about residency, please let me know. I will mention my email in the comments below. So, how you will encounter this? You are on the ward, your senior resident or your staff will come and ask you to discharge a patient. If the patient was admitted for a couple of days, that's awesome because it's much more easier than discharging a patient who has been in the hospital for a month. So there are many things that you need to know about the discharge. So discharging a patient is transitioning them from one facility to another or from one facility to the community. But you have to ask your questions. Are they ready to be discharged? So first, you have to ask yourself every day, what was your patient baseline before coming to the hospital? How much help they had and how much help do they need now? Is their underlying medical condition treated or not? Are they on any IV antibiotics or PO antibiotics? Are they requiring any oxygen? What is their living situation? Are they able to eat? Are they able to go to the washroom by themselves? Do they need assistance? Can they drive or do they need transportation? Do they have any services in the community? All these questions you have to ask yourself on a daily basis, and when you discharge a patient. And if the answer is yes for all of them or most of them, the patient is ready to be discharged. And it's also important to know where are they going. Are they going to a rehab center? Are they going to a nursing home? Are they going to a retirement home? And those terms are very confusing. And I just want to familiarize you with the types of senior care homes. There are many names and many types, but I just want to give you a general idea. So first, we have the nursing home or long-term care homes. And there are centers for elderly people who are completely dependent on their caregiver. There will be a nurse available 24/7 and there will be high level of care. Two, we have the retirement home. So it's a privately paid residence for seniors who can direct their own care. They can take care of themselves, but they need some help with their daily living activities. And there are subcategories of retirement homes based on the degree of support that a person needs. Like you have independent support living, you have assistance living, you have a specialized dementia care, you have memory care, and then you have short-term stay for people who might need some help when they are leaving the hospital and they are going back to home, but they just need some assistance for a short period of time. When it comes to discharging a patient also, that there are many teams involved. Like social worker, consulting specialists, occupational therapist, physiotherapist. But your role as a resident is to notify all the services and ask them to assess the patients and facilitate outpatient referral. And the most important thing is medication reconciliation, which will you do as a resident. But what is medication reconciliation? By definition, it's reviewing medication and verifying that the patient's medication list when they transition from one point of care to another. Like when they come from the community to the hospital, you do medication reconciliation. Or when they leave from the hospital to the community. And it is very important to identify the changes in the medication, the change in doses, and notify the patient about them. And to make this happen, you need to understand or you need to know the patient's pre-admission medication list. Also, you have to take into consideration even if there is a change in the genotype, like let's say they are taking aspirin and it was changed to ibuprofen, is that because like one of the medication is not available or because of a preference? Or let's say a patient was admitted to the hospital and initially they went to ICU, so they needed proton pump inhibitor, but now they are on the medicine ward and they are ready to discharge home. So you have to ask yourself, do they need the proton pump inhibitor? So every medication that it's going to be written on the discharge note, it should have the purpose. Also applies for the substitution, as I said earlier. Sometimes you might substitute like Pantolog with omeprazole because omeprazole is not available in the hospital, and when they go back to the community, they can go back to the Pantolog. So familiarize yourself with what's available in your hospital and every change to a patient's medication list. And finally, the most important, you're going to write a discharge note. So let's go together and see what are the things that you need to write in your discharge note.
Okay, so this is an example of a discharge summary. Different hospitals have different templates. Even different services in the same hospital might have different templates. For example, the cardiology service in my hospital have very detailed past medical history, and they like to write that in their discharge summary. And they talk about like in details about like the past medical cardiac history, like the heart failure, the valvular issues, the coronary issues, and then they talk about the other types of past medical history. Like oncological discharge summary might entail in details what happened to the cancer and the investigations, or the patient past medical history regarding investigation. So every like from rotation to rotation, you're just going to learn, and always ask your supervisor or your senior on if they like to use a template, if there is like a way they like to write it, and always ask for feedback. This is the best way to improve yourself. The way I'm presenting it, it could be different in different hospitals. So, but the general, like the outline is usually the same. So here, like we have the general internal medicine discharge summary, the patient name, for how long they were admitted, and what is the reason of admission, and who is the most responsible physician taking care of the patient when that patient was admitted. What was the diagnosis upon admission, pre-existing condition that affected the, or like pre-existing condition that did not affect the length of stay, like the patient had already hypertension, type 2 diabetes, valvular AFib, he was on warfarin and congestive heart failure. What is the reason of the injury? What is the reason of admission? Is an acute kidney injury, elevated INR. Here I did not add pyelonephritis. Again, like medically, this is not 100% accurate. I just made up this just to show you what is the reason or how to write a discharge note. So summary of the hospital course. Your main goal is like, you're just going to tell a story. If I told you like, I went on a trip, so you're going to ask me, what did you do? Of course, I'm going to tell you about the like exciting things that I did. I'm going to tell you about interesting food that I ate, but I'm not going to tell you in details on my time during like staying in a hotel or Airbnb, right? It really it doesn't affect our conversation or how much did I enjoy my trip. So again, staying in the hospital, like it's not similar, but you're going to write or you're going to tell the important things that happened in the hospital. Like if the patient white blood cell count increased a bit and then came back to normal during like because of his infection, it's not as significant as an abdominal CT scan showed pyelonephritis, for example, or if the blood culture grew E. coli, it's much more important to mention this versus mentioning that the patient had some reactive thrombocytopenia because of his underlying infection, right? So the important things that cause the hospital stay or admission and the important investigations that happened during the hospital stay. So you start your note by, we have a 65-year-old patient with past medical history of congestive heart failure, hypertension, type 2 diabetes, valvular AFib on warfarin. He presented to the hospital with XYZ symptoms. He was admitted to internal medicine team for the following issues. So we talk about each issue and what happened for this issue, or what treatment the patient received, or what investigation the patient received. Like our patient presented with fever and urinary symptoms. and he was most likely has pyelonephritis. His blood pressure was a bit on the low side. He got some fluids and he improved. And then he was started on IV antibiotics, and then this was a step down to PO ciprofloxacin. What did the blood culture show? So this is important. And the patient, after improvement, we tried to investigate the underlying cause. So we asked him what caused his symptoms. He mentioned that for the last year he has been experiencing some difficulty in urinating. So he was started on tamsulosin for his prostate, and the patient was referred to the urology. So everything mentioned in this paragraph, it is related to the fever and urinary symptoms. So pyelonephritis, he present, because why mentioning this is important. Sometimes if the patient is stable and it's not complicated, pyelonephritis, it can be treated with antibiotics as an outpatient. But here mentioning that his blood pressure was low and his lactate is important, it justifies our admission. So it's important to mention this. And it's important to mention that his serum lactate was elevated. It's another way to say that he had really bad or severe presentation, and he was almost in sepsis or septic shock. And also, we're showing the person who is reading this, that we try to investigate the underlying cause, which was enlarged prostate. Most the discharge notes will be read by the family doctor, because they are the people, or they are the physicians who will take care of your patient after they leave your hospital and go back to the community. And sometimes, or also it can be read by other residents if this patient presents to the hospital again. So people will look at your note and see what was the reason of previous admission. And for some reason, our patient who have AFib was also found to have elevated INR. So we talk about this, that he had elevated INR. We stopped the warfarin until the INR came back to normal. And then we asked him to follow up with his family doctor regarding the elevated INR. So those are two issues. Sometimes patients might have many issues. But this is a relatively short admission. And just for the sake of the video and the sake of teaching, I made it short so we don't go into a lot of details. Then we have to mention important investigations. Like if the patient had positive blood culture, so I should add the blood culture here. Imaging studies. If the patient had other investigations like head CT scan or a chest X-ray that showed pneumonia, or chest X-ray that showed nodule, it's important because those investigations, the family doctor might look at them. And also investigations are important to mention them in the discharge note, because it depends on the state or the province, where are you at. So sometimes here in Canada, in Alberta, usually whatever investigations is done, my understanding is it's uploaded to a centralized network where it can be accessed by other physicians in the community. Here in Ontario, we have something similar, but we have something called Connecting Ontario, but not all the investigations are uploaded to this server. Usually discharge summaries and important blood investigations sometimes are uploaded, sometimes are not. It depends. It's really variable. So it's important to mention investigations that happened during the patient's admission, because this could be the only way that the family doctor can access the information of the hospitalization. And then we're going to talk about medications. And here it's very important, as I mentioned earlier, that lots of mistakes can happen in a medication reconciliation or medication review when a patient is being admitted to the hospital, being discharged from the hospital. So it's really important to talk in details about what medications are changed and what medications are not changed, because the patient also might take a copy of the discharge summary and read those things. Again, those are not 100% accurate for our patient. I just wrote them to show you how to display the medications in your notes. What are the medications that were unchanged? What you're going to tell the patient, he should take ciprofloxacin 500 for 10 days or for 20 days. Then referrals. So you refer the patient, or we refer the patient to urology. So we refer them to doctor, his name, and he has an appointment on this date. Sometimes you might not have the date. So you tell the patient in this note, if you were not contacted, please call X number for follow-up. And then patient instructions upon discharge. And this is really, really, really important, because your patient spent 10 days or 4 days in the hospital, they might not understand most of the things that they were written earlier, but they might look at this and say, okay, so I should do 1, I should do 2, I should do 3. It really simplifies them. So this paragraph, I believe it's very important, and it's so important to write it in plain English language. Don't use medical jargon, and make sure to make it as simple as possible. Imagine you are asking one of your parents or a family member to read it. If they can't understand it, the patient can't understand it. Okay? And then instruction to the family doctor. I really like to add a paragraph at the end. Why? Family doctors see lots of patients in a day. And this is around 2 pages discharge summary. And it's only for 4 days. Most of the patients that come to the hospital have multiple comorbidities, and that's why they present to the hospital in the first place. And usually their length of stay could be anywhere between 5 days, 10 days to 20 days, 30 days. I've seen patients who spend months even in the hospital. And the family doctors, as they see lots of patients, they can't spend, or they don't have enough time to spend reading the details in your discharge summary. And most of them look to a similar paragraph at the end. Make the job of the family doctor or general practitioner who's taking care of your patient as easy as possible. The patient, our family, we are asking the family doctor, please follow on Mr.'s ABC's INR. Done. So if he sees this will save him lots of time, because he knows what are the things to look for when he's going to follow up with the patient. He might not have the time to read all these paragraphs. This is short, but usually discharge summaries are much longer. So this is really helpful. So what I'm going to tell the patient upon discharge, what I want to tell the family doctor upon discharge. And then ask your staff. Some staff really like to give their number to the patient or their email to the patient. So you can write at the end, please contact the doctor, whoever was the admitting physician during the patient's hospital stay, on the number XXX. If they are questions, or if you have any concerns about your admission in the hospital, so they can contact that physician and they can have a conversation, or they can email them, ask them some questions about their admission. So those are the main parts of the discharge note. Again, you're gonna find lots of variability. See what are the things that your hospital like to do, what is the template that the service like to use, and based on that, always try to improve your notes by asking other people for feedback. But in general, this is the outline, and those are the things that you want to mention at least in your note. I remember the first time I was asked to write a discharge note, I was like, what is discharge note? I've never done a discharge note before, so it was a bit hard for me to figure things out. But over the years, I learned. So it's just a way of communicating with the family doctor or the other person who's going to take care of your patient. So make it, again, short and sweet, and mention only the important things that will affect decision making. I will mention one last thing, that also discharge summaries have a really important role in research. Retrospective studies, right now, I'm working on a retrospective study, and I go back to look at discharge summary and extract informations. So when there is a nice written discharge summary that have the important investigation and the important information that I need, it makes my job very easy. So you don't know, maybe your discharge note will help to change medical practice by providing data to future researchers. So write a nice, sweet, with important details discharge note. Okay, guys, this is the end of the video. If you have any questions about residency or anything about discharge note, please email me. You're going to see my email in the comments below. Okay, I will see you in the next episode.